My road to my specialty was kind of a long road. Initially, my grandfather was an ear, nose, and throat doctor here in Omaha, and I had initially wanted to follow in his footsteps and be an ear, nose, and throat physician. Ear, nose, and throat, since it was a specialty, was part of an early match process. They recommended we also pursue a normal match program, general surgery, internal medicine, or OBGYN. When I got to my third year of medical school, around the time you start to pick, my wife had gotten pregnant. It was our first pregnancy, all the excitement that goes with that. We got to about 20 weeks along and there was something wrong with the pregnancy. Everything didn't look like it was the way it should be. A few weeks later, my wife was exposed to an infection that could affect the baby. Repeated the evaluation of my wife and found that there was multiple things wrong and our baby was very sick. At that point, we ended up getting referred to a perinatologist, one of my partners, Dr. Robertson, actually. He ultrasounded my wife and said, this looks like it's probably a lethal diagnosis and you're probably going to lose the baby. About 2 days later, we found out our baby had trisomy 18. And it was the same day I was taking my final exam for my OB rotation in medical school. I'd had my fill. My wife and I ended up losing our child about a month later. And never wanted to see a pregnant woman again. Lo and behold, about 8 months later, my wife was pregnant again. Happy, healthy little boy. Everything was going smoothly. And I thought, well, I'll go back and do 1 month, and we'll just see how it sits and see how I feel. I ended up going back and doing a month of maternal-fetal medicine and absolutely fell in love with it. There was lots of surgery and lots of medicine and challenging puzzles that really kind of made it just a perfect field for me. And the fact that I could relate to people who'd gone through what my wife and I went through just made it absolutely fantastic. So I ended up calling my grandfather and telling him I wasn't going to be an ear, nose, and throat doctor. Withdrew from the ear, nose, and throat match and pursued a match in obstetrics and gynecology with the plan of going on to do maternal-fetal medicine. I think what I like most about it is the relationships we develop with our patients. The fact that we get to be there to see a baby born, see its first breath, it's a gift to get to do what we do and to be there for that part of a family's growth. And these are monumental steps in someone's life that really there's no other field in medicine where you get to do that. These are going to be #1 memories on almost every parent's list for the rest of their lives. What's the #1 thing you remember? Birth of my first child, birth of all of my children. We get chosen, invited, selected to be a part of that on a daily basis, which is, I think that's my favorite part of my job. We get to be a part of somebody's best day of their life every day. It makes every day a good day. We're gonna need Kleenex for this. It's my wife. Having been on the patient side, anytime I tell her, patient called, I need to go in, she never bats an eyelash. Keep in mind, we've got 4 kids to take care of. She doesn't ask how long. She doesn't ask when I'll be home. She doesn't ask who it is, what's wrong. She understands if I need to go, I need to go. My wife is the only reason I can be the doctor I am. I think communication and trust are integral in a patient relationship, and I'm fairly open with my communication with patients. A lot of my patients, since they have my cell phone number and have my email, afterwards will send me pictures of babies. And I got a Christmas card today from a couple I took care of 2 years ago in Colorado, and that's what medicine is to me. It's establishing that relationship. A lot of these moms I'll never take care of again. They may not have more children, they may be done having children, but I still want to hear how those kids are doing 2 years later. And I've been invited to come for birthdays and things like that, and so if I have the opportunity, then I try to go and see those kids and those families again. I think I was born 50 years late for medicine and how I choose to practice. If I had my way, I try to practice the way a doctor in a town of 5,000 would.